swiftly move on to our next presentation, which is also looking at issues during the pandemic. This is a piece of work conducted by Sarah Ovchacek-Galstek Tekar. I can't quite say that very well, but forgive me, Sarah. And her work was on exploring the impact of COVID-19 on owners' healthcare seeking behaviour in relation to chronic conditions in dogs. It was a pilot study, and Sarah is from the Dogs Trust. First, we'll hear her recorded session, and then we'll have a Q&A with her.
Hello, I'm Sarah Ovchacek-Galstek, and in this presentation, I'll discuss findings of a study exploring the impact of COVID-19 pandemic on dog owners' healthcare-seeking behavior, in particular in relation to chronic health conditions. Throughout 2020 and 2021 in the UK, multiple lockdowns introduced to slow down the spread of COVID-19 meant that access to veterinary healthcare was restricted to emergencies only. Therefore, the overarching aim of the study was to explore various ways in which the pandemic impacted upon veterinary healthcare seeking, specifically for dogs with chronic health issues who may not seek care for emergencies, but to manage dogs' health. As a part of this research, we compared experiences of owners seeking and accessing veterinary healthcare for chronic and acute conditions, preventative healthcare, and end-of-life care during the pandemic. We explored owners' experiences of caring for a range of chronic health problems before and during the pandemic and the future care plans. We also sought to understand reasons for not seeking help during the pandemic. Finally, we identified factors associated with seeking care compared to considering seeking care and deciding against it and not considering seeking care, and seeking care urgently, which we defined as above median score on the urgency to seek care scale, compared to not urgently, which we defined as below median score. We collected data using questionnaires asking about owners and dog demographics, COVID relationship with the dog and vet, as well as issues owners potentially needed care for, and the decisions regarding seeking and accessing veterinary care. We also asked information on how care was received during the pandemic, future healthcare plans, attitudes to seeking care, and urgency to seek care given a hypothetical scenario. We analyzed this data using a range of statistical approaches and qualitatively. We received 719 responses. Most of our respondents were women aged between 30 and 49, educated to a degree level or above. Roughly 85% of our respondents weren't vulnerable and did not experience COVID-19. 50% of dogs were male, the median age was 6 years old, and 102 breeds were represented. 90% of dogs were acquired before the pandemic. There was a statistically significant difference in decisions regarding seeking and accessing healthcare between types of health issues that help was potentially needed for. Across all categories, most of those who wanted to access help were able to do so. There was also a significant difference in how care was received for different health issues, with those who sought end-of-life care proportionally more often being treated as usual outdoors and less often treated without the owner. Qualitative analysis showed that whereas some respondents had no issues accessing healthcare, others struggled to book and access care. Some respondents could go into practice with the practice with their dog, especially for euthanasia, but most could not, and most found this very stressful. Respondents reported being unable to go with the dog also impacted on their understanding of the diagnosis and made it difficult to communicate with the vet. As a result, many believed that the quality of care their dog received was lower than normally, impacting dog health, as the quote on the screen illustrates. Before the pandemic, dogs with chronic health diagnoses visited vets more frequently than those without, and this hasn't changed since the pandemic. Respondents described multiple home and care routine adaptation for dogs with chronic health issues. Taking care of dogs with chronic health issues during the pandemic required owners to take on some of the veterinary tasks. As treatment for chronic health issues can be expensive, for example, one owner calculated that the total cost of treatment for her dog throughout their lifetime reached £75,000, those who relied on help from charities such as PDSA were also impacted financially during the pandemic. Owners also described that the socio-emotional burden of care for dogs with chronic health problems were made worse due to pandemic-related stress. Thankfully, most respondents said that the pandemic did not affect their future healthcare plans. They still want to see their vet for regular checkups and as and when required. However, a small proportion said that they wish to retain independence from the vet, as the quote on the screen shows. Before the pandemic, most often reported reasons for seeking healthcare were routine checkups. In addition, dogs with chronic health diagnoses often sought vet care to monitor their dog's health, to administer treatments, and review medications. The main reasons for not seeking care during the pandemic was a belief that the vets were only seeing emergencies, not wanting a dog to go alone, dog's health improving, and dog behavior being difficult to manage, especially while staying socially distant. Fear of COVID wasn't a common reason for not seeking care. Qualitative analysis help us to further elucidate the decision process that many owners followed when deciding whether they should seek help. They started with understanding if the condition was serious enough to trouble the vet. Owners considered if the issue can be handled with home treatments and therapies, and assessed if the dog can cope at the vet without them. Finally, owners assessed if they can cope with having their dog euthanized at the given moment, as the final quote illustrates. We assess factors associated with seeking care compared to deciding not to seek care. Lower odds of seeking care were associated with a stronger agreement with the benefits of seeking care construct, made up of statements such as the treatment and advice provided by my vet is necessary, and stronger agreement with the statements contributing to the self-efficacy construct, made up of statements such as I'm confident in recognizing when my dog is not feeling well. Higher odds of seeking care were also associated with higher score on the emotional closeness subscale and being first-time owner. We asked owners how urgently they would seek care given the hypothetical scenarios that captured symptoms of chronic health issues. We added their score and divided them into those who seek care with above or below urgency. High urgency to seek care was associated with higher score on dog owner interaction subscale, higher score on perceived cost of dog ownership subscale, which is reversed scored, so owners who perceived cost of dog ownership as lower were more likely to seek care urgently. Stronger agreement with the statement that made up susceptibility to illness construct, such as I think that providing my dog with regular veterinary checkups or treatment is important. Stronger agreement with the benefits of seeking care, and stronger agreement with the statement, managing my dog's behavior during veterinary consultation is or has been difficult. We repeated this model, predicting urgency to seek care on a subset of owners whose dogs were diagnosed with chronic illness, as we asked them some additional questions. Within this group, high urgency to seek care was associated with higher score on perceived cost of dog ownership subscale, higher score on emotional closeness subscale, stronger agreement with the perceived susceptibility to illness, having partial or full insurance, and a stronger agreement with the statement, interrupting the treatment would be very risky. Being less likely to have high urgency to seek care was associated with stronger agreement with the statement, my dog's health has deteriorated since the beginning of COVID-19 pandemic. Being less likely to have high urgency to seek care was associated with stronger agreement with the statement, my dog's health has deteriorated since the beginning of the COVID-19 pandemic. In all models, demographic variables, the type of issues owners potentially needed help for, owners' COVID-related variables were not significant, and in the first two models, having chronic diagnosis also wasn't significant. In conclusion, further consideration should be given to allow dog owners to accompany their dogs into veterinary practices, in particular where seeking care may be avoided or delayed if this is not possible. Messaging around the importance of veterinary healthcare seeking may be improved by drawing on constructs derived from the health belief model we used, that is, the benefits of seeking help, perceived susceptibility to illness, self-efficacy, and also by drawing on owner-dog relationship. Owners with previous experience of dog ownership may need to be targeted in a different way to the first-time owners. Healthcare insurance could also improve seeking care for dogs with chronic health issues. It's also important to socialize dogs to vets and build relationship with vets so that dog behavior does not impede seeking care. Our study is limited as data were collected retrospectively and due to self-selection bias. Thank you for your attention, and thanks to the Animal Welfare Foundation for funding the study. If you have any questions, please do get in touch. Thanks also goes to the study collaborators, David Singleton, Tamsin Furtado, Taryn Graham, Lisa Wallace, Carrie Westcalf, and Imogen Lloyd. Thank you.
Thank you very much, Sarah. That was excellent. And I just have one point I should clarify. Sarah now works at the Dog Trust, but when AWF funded her to do this work, she was at the University of Liverpool, and that's where she received the funding. Thank you.
That's correct, yeah.
Good. We have some questions coming in, Sarah. One around the sample population. The owners you reported there were in a specific particular age bracket, 30 to 50, and degree level or above education. And Catherine Ellis asks, do your results therefore biased because of this type of cohort being the main part of your study, or could you explain how you treated that and how you mitigated that?
Yeah, sure. We recruited our respondents through social media by going into sort of social media related groups dedicated to specific health issues, but also dedicated to specific areas of the UK where dog owners can exchange sort of information about dogs to try to balance between seeking people who may have experience of caring for dogs with chronic health issues and kind of balancing it out with sort of more general dog owning population. Our study is very biased towards women. However, I think this is common to most convenient samples and convenient sort of sample research focus on dog behavior. I think that most studies have majority of female respondents. In this respect, we are not much different to other research. And some studies looking into gender and effect of gender on human-dog interaction suggest that there isn't that much difference. So yes, the population is biased, but with this respect, I don't think it's necessarily much of a problem, especially if women are normally the main kind of caregivers to dogs. In terms of education and age, our sample is not representative of the general dog owning population, and we try to kind of take it into consideration when discussing the results and when publishing the research in the future.
So when you looked at your population sample, did you have a group in the lower education bracket and did they behave any differently, or did you not have a sizable number in that area?
We did have about 15-20% in the lower educational bracket, but they did not behave in any different way. Perhaps some of the comments regarding finance came from this part of the population. So people said that before the pandemic they relied quite heavily on support of charities such as PDSA, and those people sort of raised concerns that access to those services was a little bit restricted, and they said that has impacted on their finance. So even though in our sample this was a minority of respondents, I think that within the general population it may be more of a problem than it was to kind of in our study.
Yeah, thank you. We have another question which refers back to our previous talk. This is from Susan Cunningham. Do you think there is also work to be done on whether these pets really needed to see a vet? She relates this to the previous talk about adjusting owner expectations.
Definitely. I think that some of the comments that respondents left as to why that they did or didn't seek help were around them being unsure if they needed to seek help at that very point. Perhaps because of sort of nature of the study, those comments were usually around people seeking help a little bit too late and sort of reflecting that if it wasn't for the pandemic, they would have seen help earlier. But there was a lot of doubt around when to seek help and at which point they should seek help. And there's definitely a gap in terms of educating dog owners as to what requires urgent treatment and what could perhaps wait.
Great, thank you very much, Sarah. I think it's really important that we do spend time considering what happens with chronic health problems. During a pandemic, it's easy to focus on the emergency situations and the times when vets are attending to dogs with critical issues, and we shouldn't forget the difficulties surrounding chronic problems in our animals. So thank you very much. Excellent last talk to round off the day. I'm now going to pass on to Chris to draw today's forum to a conclusion. Thank you, Chris.